So body contouring devices continue to evolve, and a lot of times when we pick the wrong patient for the wrong device, we don't see results. With the great change that we're seeing with GLP-1s, more people are spending on the GLP-1s because they call it a skinny shot, rather than actually spending on something like a cool sculpting device or a ultrasound device. So we saw there's a dramatic decrease in terms of spend in that body contouring market. But what people don't realize is that 70% of the weight loss that's occurring from a GLP-1 typically, most typically, is due to loss of skeletal muscle. So we need to talk and think about ways that we can actually improve the skeletal muscle and create more of a loss of fat rather than the actual muscle. So I think that we're going to see a nice change. This is going to be a trillion-dollar industry in terms of the GLP-1s. And as people see the long-term effect, I think we're going to have to continue adding something that's going to be a muscle stimulatory device. So when we say, do they live up to the hype? I think in the right patients, you can get amazing results. But it's also setting realistic expectations. And if you have somebody who has, it's not about a BMI, but how much superficial fat that they have or subcutaneous fat versus how much visceral fat that they have. And if they have a high content of subcutaneous fat, there's lots of things that we can do both surgically as well as non-surgically. For visceral fat, it's always going to be based on the kitchen. It's what you're putting in the mouth. And the greatest way that we can have success in the past, I would tell all of our colleagues, is if you can sew somebody's mouth shut, you're always going to get a good result. And we found a way to do a shot to do that same thing, right? Because people aren't eating because there's less gastric emptying and things. Now, the benefit of a GLP-1 is remarkable because it's going to be a really decreasing the inflammatory response that we have. So we're seeing great side effects in terms of things like psoriasis, eczema, seborrheic dermatitis, and also functionally with the decrease in dementia. So if there's less of an inflammatory process that's going on in the brain, can we actually improve our longevity? So I think the promise is there. We may be overusing or overutilizing the shot, but I think that there's going to be a dramatic shift in that space and therefore in the space of body contouring.